So these were the results of the poll that I put up yesterday talking about medical assisted weight loss. It was really interesting to see your answers to the question that I posted. I'm glad that most of you voted no, that people actually do need these medications. Some of you voted that you don't know enough to make a comment or an educated guess, which I'm glad that you did, because a lot of what's going on at the moment is misinformation driven by people's misunderstanding of medical assisted weight loss. So why are more medical practitioners getting involved in weight loss? It's interesting to note that medication prescribed for weight loss has been around for years on end. And no, it wasn't just recently with the injectables that gained popularity that drove our interest in weight loss. There have always been medication on the market, usually your phentermines or pseudoephedrine-based medications that we use to help people to lose weight. Unfortunately, though, those medications were not exactly healthy for patients. It came with its own complications, especially cardiovascular related complications. A lot of patients abused this. We started to see a few complications, including gallbladder issues, a rapid increase in hypertension, cardiac failure, and cardiovascular related adverse events. There's always been this interest and I want to say investment into medical graded weight loss. It's not just doctors and dietitians. Your pharmaceutical groups have always been looking for more safer solutions that not only address weight loss, but that can help with other factors as well. Those of us in the medical industry focus on obesity and weight loss and how we can treat it, not so much for the aesthetic point or benefit of this, but also because of the complications that come with obesity and an abnormal weight gain. Other than the increase in cardiovascular events such as heart attacks and hypertension, we also have an increase in cancer. So this includes colon cancer, kidney, pancreas, esophageal, and unfortunately in our females who are obese or overweight, we find an increase in endometrial cancer and postmenopausal breast cancer. We also find that these patients are at higher risk of developing type 2 diabetes, dyslipidemia, gallbladder issues, and gout. Not to mention, these patients are at a twofold increase of developing mood disorders such as depression, anxiety, and eating disorders. So taking all of this into account, it makes sense why so many practitioners like myself have dedicated time and effort into helping people to lose weight. It's not just about helping them to look and feel better, there's actually health-related risks involved that we are trying to control. So why is there a need for pharmaceutical-assisted weight loss? The truth is, exercising and diet, while it can work for a lot of people, and it's great if it works for you, for the mass majority of patients that suffer with obesity and abnormal weight gain, it's not as easy to lose weight with just exercise and diet. There are sometimes barriers involved that prevent a patient from losing weight as easily as others. We talk about genetics, which influence your ghrelin and leptin hormones, your basal metabolic rate, and even your fat storage and distribution. There may be mechanical issues such as rheumatoid arthritis, osteoarthritis, and chronic pain, which hinders a patient's ability to exercise. There are metabolic risk factors such as type 2 diabetes, hypertension, and polycystic ovarian syndrome, which actually inhibits a patient's ability to lose weight with exercise and correct diet. And of course, our mental health patients. Depression, anxiety, eating disorders, bipolar, even just chronic stress can interfere with the patient's sleeping habits, eating habits, and make it more difficult for patients to lose weight without pharmaceutical assistance. Some of you answered and said that people should not be taking these medications because of the risks involved. And I always say to patients, every single medication that you take has some sort of risk involved, including the Panado that you take for a headache. Yes, if eating and dieting is working for you and you are able to lose weight, then that's fantastic. But for the mass majority of patients that walk into my consulting room, they have already tried everything they possibly can. And there is either a barrier that's stopping them from losing weight with just diet and exercise, or there's an underlying condition that we need to be treating. It's for those specific individuals that pharmaceutical assistance is needed. And now in practice, we are moving away from phentermine-based and pseudoephedrine-based medications because of the high risk involved with them. We focus a lot more on your GLP-1 or GLP based medications, as these have been shown not only to assist with obesity and abnormal weight gain, but they carry cardiovascular, renal, and anti-inflammatory benefits as well. Not everyone needs pharmaceutical assistance when it comes to weight loss. If you or someone you know is obese or struggling to lose weight, it's more likely to be a medical condition that requires our assistance, which is why I encourage these discussions in practice. Obesity, abnormal weight gain, or difficulty losing weight is not something to be ashamed of. It is recognized as a medical condition with its own complications and risk factors involved. And because of that, there's more doctors like myself who are willing to assist not only with investigations, but medical assisted weight loss.